Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, 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 Atish Ellis. Welcome to our weekly show. My name is Abby. May Healthy Living NP. Welcome to all of you who are joining me from Abby Tyler's Healthy Living page. Focus on Liberia and also on YouTube. How are you all doing today? Hope all is well. As you can see, the show today is just going to be like a candid conversation about my thoughts on Princess Catherine's health. If you don't know who Princess Catherine is, she's just Princess Princess of Wales, and next in line to be the Queen of England. So again, my disclaimer: I'm a provider, but I'm not your provider. So please do not make any changes to your regimen without checking with your own provider. Okay. So please share the show. Please give me a thumbs up. Share the show, invite others. Okay. Let me just go back here to my banner. Okay. Alrighty. So unless if you haven't been following Princess Catherine, again, like I said, she's the queen to be already. And she was gone for a while. They said she was having abdominal surgery, and then last week she came out and revealed that she has abdominal cancer. Now, for a female saying abdominal cancer, it could mean anything. She didn't specify, and I'm not going to sit here and speculate. I'm just going to give my educated guess, and then how it relates to us to regular people. I don't like to say regular people because we are regulars, but people who are not royalty. Okay, because people get sick and it affects anybody anytime, regardless of your social status and all that. So she admitted that she had abdominal surgery and then she has abdominal cancer. So again, for females and males, we have certain organs in our bodies. Let me go in here for a second. That we kind of share the same thing. We share our spleen, we share the pancreas, all that. It helps with control your blood sugar and all that. We have our liver, we have the stomach, actual stomach. When we say abdominal cavity, we're talking about the whole, like people see the whole thing and says, my stomach, but there's so many organs in the stomach there. So I would go in here for a second. So it could be any more of those things. And the fact that she doesn't want to talk about it because she doesn't have to anyways. But it's just that because she's a public person and people might say, oh yes, somebody who's like really famous and all that, that's the reason why you're talking about it. But unfortunately, most of these things don't come to light and most people don't get to know about these diseases or any whatever is going on until it affects a public person. So in a way, it's unfortunate for them, but it's also like it kind of helps. And most of the time, too, when something happens, that's what we learn from it. All right. Because sometimes most people don't feel it until like it's like somebody that they know or somebody they maybe might admire or whatever it is. So she's out there. So, and this is Women's History Month. And at the beginning of this month, I talked about, women's history and making sure heart disease, checking your numbers, making sure your blood pressure, your diabetic status, your diabetic numbers, making sure that you go in to go get seeing your family doctor every year or as often as they want you to come. Also following up with your OBGYN, gynecologist, you were supposed to see them every year for your screening. And depending on how often they want you to come into the screening. They did say every 3 to 5 years and all that too, depending on your medical history, your family history and all. But most GYNs are also saying they want to see you every year because anything can happen within that 3 year period. So speak to your doctor about that. Alrighty. So let me just go in here. So again, like I talked about, I'm going to put this picture up here. I don't own this picture, by the way. So this is the abdominal cavity. See, this is where my cursor. When you're watching this later on, you can stop and watch. This is everything. You were talking about your liver, your pancreas, and all. But when you're talking about the female organs also show down here. All right. We're talking about ovaries, the uterus, what we call the womb, and everything else that comes below that. Okay. So, and we can go in here and you see a better picture here, your ovaries and also all of that is like lower in the pelvic, that's what called the pelvic area. So like below your belly button, way below there. So it could be any one of those things. And some of those cancers and all that too, you have no symptoms, especially when it comes to like ovarian cancer. Usually when there's any kind of testing and screening, that's when it's like sometimes it's almost too late. That has like, mostly. So the most important thing, this is how it relates to us now already. So it's important that you go see your family doctor every year. Like I said, get your blood work done. There's certain things that we check in the family practice and all that, but you start looking at and you start looking for symptoms and all. So some of the things you want to look for. All right, let's go for some of the symptoms that would indicate these doesn't mean these symptoms don't mean that, oh yes, you have cancer, but it's just some of those things that you're looking for, especially as a woman. Okay, so unexplained fatigue. Let's say you don't find any reason why you're tired. You're doing the same kind of work every day. You go into different places. Your activity level hasn't changed or anything like that, but you just find yourself very tired all during the day. You wake up, you just cannot. It's like there's something going on. Something going on with me. I'm just tired all the time. And if that's going on for 2 to 3 months or a period of time, then bring that to your doctor's attention, because usually unexplained fatigue, sometimes it may be just some vitamins that you're missing. Sometimes it can be something wrong with your blood work, at a blood work that you just need some supplements and additional medication for a short period of time. But you don't want to just ignore that over a period of time. Okay. Watch for any kind of abnormal bleeding. When you have your period, for those of you still see your period and all that, you know how your period is for you. Everybody's period is like separate. Okay. You have, different settings, but we do have like a general thing that we look at. All right. You see your period once a month. If you start seeing your period like more often, or the bleeding becomes even more, you find yourself going through so many different pads over and over and over. And they tell you that, oh, okay, yeah, when you come and say, okay, how many pads are you going through? Are you using the regular pads people use in the daytime, or you find yourself using a nighttime pad, because people seem to bleed more at night? Are you using that more during the day? Are you going through more than one pad in an hour? You find yourself bloating. And when when it's coming out, is it coming out heavy? Is it coming out a lot of pain, a lot of cramping? And again, sometimes it could just be they just need to put you on some medication, or just something over the counter to help you with that. Okay, but that over a period of time, you start noticing that the period is much more heavy than normal. Bring that is, if you don't have, even if you do have fibroids or like endometriosis or anything else, anything that's GYN related, you still want to bring them, because that's a change from the norm. Okay, bring that to the attention. And of course, if you're bleeding very heavily too, you're going to become anemic, like how some people can say low blood. That can also have an effect too, because when you become severely anemic, that can also affect your heart. And also, it's important that you go and get that check. Okay, because they may need to put you on some medication, or sometimes medication to control the bleeding, and also medication to replace your blood. All right. Okay. Also, I talked about severe pain in the back, where you're in your period, like, okay, something's wrong. All right. I know I get the period pain, but I need to go get that check. Already. And also, when it comes to like the stomach area, because again, it's not just talking about women that's just below in the reproductive organs, like in your ovaries, your uterus, and all of that. All right. Diarrhea, when it comes to the stomach part now. All right, unexplained diarrhea. You find yourself, diarrhea, meaning you go in number two, and it's like coming out watery over time. It could be like, okay, something's going on there, and it could also be something that's blocking your colon. All right, the tube that your poop comes through, something's blocking it, that's causing you to be in. It just kind of, the stool is just coming from around it, and something is blocking there. That little blockage, that could be something, maybe it's just hemorrhoids, or it could be a mass. Okay, what we call tumor. So it's important that, is that going on for a period of time, you find yourself, maybe especially for over a week, and you haven't traveled and nothing's different happened, go get help. All right. I'd already talked about persistent fatigue. If it's just any blood in your stool, let's say, okay, yeah, I was training, I had a little bit of blood in my stool, and it went away after a while, but now it's coming, and it's coming out more often. Even if you don't have any pain with it, there's any blood in the stool, make sure you go get it. There shouldn't be any blood in your stool. All right. If you had hemorrhoid before, you and your doctor have already spoken about it, but just get that check. All right. There should not be any blood in your urine also. If you're not on your period, where it's like, okay, yes, you go pee and then there's some blood in there and all, that's different. Any other time, you should not be having any blood in your urine. That goes also for you men, and also for, again, that's because we're doing Women's Month now, but that applies to everybody. Already, if you've gone through menopause, meaning you haven't seen your period for a whole 12 consecutive months, not like, okay, yes, I saw it for 3 months and then I didn't see it again. If you haven't seen your period for 12 months and you're done, and you start bleeding, it's important. It's very, very important. You should not be bleeding after you reach menopause. Okay, go ahead and get that checked. All right. Also, nausea, vomiting, that goes back to the stomach too. Any kind of nausea, you find yourself like, okay, there's something going on there that I eat, but I just feel like I'm going to vomit all the time, even though you've tried other something else. And sometimes you're actually vomiting too, but you just like you find yourself staying away from certain foods because it just causes nausea. But then after a while, this persistent nausea is still there. It's important we get that checked. Alrighty. And also, unexplained weight loss. Let's say if you're taking any medication, if you exercising or you're eating healthy and doing that and you're losing the weight, that's different. But you find yourself losing weight and you haven't been doing anything to do that. And people are, first couple of months, people might say, oh, look at you, you look like you're exercising, you lost some weight, or you're doing something there that's making you look like that. And you don't notice that. But over a period of time, you're like, I'm not doing anything and I keep losing this weight. And something must be going on there. And I mean, you start having some other symptoms, like sometimes you can be like, okay, yeah, the fatigue, losing the weight, short of breath. Again, at nighttime too, that could be, it could mean anything else, but it could be that. All right. So it's important that these are the symptoms you want to look out for. And you look at your body, look over your body. Do you see any different discoloration, like a mold that was there before, but that mold is getting better, like a little, nodule is getting bigger, or is getting the borders are not even anymore, or you see it's changing colors. And also keep an eye, like I told you guys before, take your clothes off, looking for in the mirror at least once a month, look front and to back. And if you have somebody there who can, look it over and say, I know there's something, there's a birthmark there, but it has changed colors over a period of time. So that's important. Okay. We also had this YouTuber. I didn't know her before. I just got to know who, Jessica Pedway, who died from cervical cancer recently. And it says she went to go get her testing done, and they told her it was fibroids, but they didn't do any additional testing until it was too late. Now, if you're going also cervical cancer, the cervix, I did a show on cervical cancer, by the way. I think I will post that in the feature section of the forum. The cervix is the one that opens up from vagina, is between the vagina, opens up here. You can't see it unless you see the GYN already, because it's sort of, so that's the part there, but that's the part that holds in the uterus and all that. You need the inside part. So there's an outside part and inside part and all that. So you can, I mean, you even know if somebody didn't tell you that you had a cervix and all that. Okay, so and that's what makes it important at age 21. At age 21, you should be going to go see your GYN, all right? And depending on, you're supposed to be doing it every year, because it was every year, but it was saying like some places, or some of the guidelines are saying 1 to 3 years, depending on your history again. Every year at age 21, regardless of whether you've had sex or you virgin, whatever, it does not matter. You are supposed to be going to your GYN and getting your cervical cancer screening. You just go in there. It's called Pap smear. All right, I talked about this before. You go in there, you get on a table. It can be a little uncomfortable. Most doctors have something in up there in the ceiling now. You go in there. It's basically this is your discretion is advised. I'm talking adults stuff here. You go in there, you open up your legs. All we do in there, we go in there, open it up with the speculum. Is a device that we have to open it up in order to see. We look at your cervix and all that. So we go in there, we scrape some of the scale cells, we put it in the container and go in there and then put our finger in, check for the uterus, check for everything else, making sure that there's no pain when we're doing that. It's going to be uncomfortable, but it's not supposed to be painful. All right. And then we send that to the lab. Usually the lab will come back and the results will come back and it will tell us what's going on if we see any kind of cancer cells. So I'm assuming she probably had fibers before, whatever, but just say, okay, maybe she was having some heavy bleeding and it didn't check. You're supposed to be going every month and every year anyways. If you feel uncomfortable, you please go and get a second opinion. And if it means for you to take somebody else with you when you go see your GYN and say, I feel there's something going on and I'm not getting the kind of answers that I'm supposed to be getting from you, if the person is still resistant, go get a second opinion. Go get a second opinion. Your life and depends on it, because sometimes, most of the time, cervical cancer don't have any other symptoms. And again, like I said, the outside part, you get cancer and it goes, and then it goes up into your uterus, which we call the womb, and that can go up there. And before you know it, it has advanced. Ovarian cancer, usually they say bloating, but then you could be thinking, well, maybe I just ate something, I feel that way. But it's usually, to do the ultrasound and all of it. But most doctors don't like to go in there and do any biopsy. But again, cervical cancer, get your cervical cancer screening, age 21. And then depending on what your medical history, your family history and all that, depending on the symptoms, depending on your presentation and all, your doctor will follow up from there and say, I want to see you back in 6 months. I want to see you back next year. I want to see you back whenever. Uterine cancer, where your womb is, also that can also heavy bleeding. So most of the main symptoms are like heavy bleeding, unexplained weight loss, and all. But you don't want to get to that point already. You want to make sure that you go in to get your screening every year and speak to your doctor about your daughters and all and your sons to get the shot for HPV, because the human papilloma virus is the one that can cause cervical cancer. That can also affect men too, but it's usually because whatever they do in the mouth, they can have throat cancer and other things also. Alrighty. So it's important. And again, like I said, this YouTuber who she was like influencer before everything became big, and I was reading about her. It's pretty sad because I think she was only 36 when she died, and all, and left the two young children behind. So it's important that yes, we have to talk about Princess Catherine when and she's this royalty person, so we have to talk about her and all, but also her illnesses can bring attention to people out there. A lot of people don't know. They don't know, as most women don't know, like their body makeup and what they're supposed to be looking for and all, because it's not something that we talk about, especially if you come from certain cultures where nobody want to talk about certain things like that, because oh my God, I don't want to talk about her body, because then next thing you know, she's gonna be looking for men and whatever. You have to talk to your daughters, talk to your daughters, talk to your daughters, talk to your daughters. Tell your friends, have you gotten your cervical cancer screening yet? Okay, if anything, something's going on, we can do the ultrasound. Yeah, if you have to do the CAT scan, but first with the ultrasound, and they can check there to make sure you don't have fibroids, and even anything they do to do a biopsy, they take it, they send it to the lab, and we get the results back. Okay, so it's important. Get your cervical cancer screening. Go see your OBGYN every year. Also, don't forget breast cancer. Don't forget breast cancer, right? Get your mammogram every year. If they tell you to follow up, please follow up. If you have high risk, if you're at a higher risk, where your family member, a close family member, mother or sister, even on your father's side, that has had cancer before, tell them so you can get your screening early. Colon cancer. I talked about the diarrhea, and we talked about what's his name, the one who was Black Panther. He was only 42 years, or 42 or 44 when he died. Okay, so make sure if you have any history of that, they say now about age 45. They're recommending age 45 that you go ahead and get your screening done. They have the one way they can send it to you, and you can send the stool to them and send it in the mail. But you and your doctor will determine which one is better for you based on your risk factors. Okay, most of the times, most and GI doctors, gastroenterologists, they want to look up your colon, so they'll say you can do that, but we advise that you get the colonoscopy. Drinking the prep and all that may be a little yucky, but the test itself doesn't take that long. Light anesthesia, they do it to get it out of there. You come out of there, maybe they found some growth, what is called polyps. They take it out, they send it to the labs, and at least that way you're safe. They'll say come back in 3 years so we can check again, or come back in 10 years if you're fine. All right. So women out there, men, if you're listening to, and I hope some of you are watching this, please, even if you're a mother or not a mother, whatever affects, but especially if you're a mother too, what affects you as a mother affects the entire family. If you're not a mother, you're married, or somebody who, your sister or a daughter and all that, nobody wants to see their family member go for something that can be prevented. Can it be prevented 100%? No. All right. So, but it's important that the early detection is key. Early detection is key. So, just want to finish this up. Make sure you're getting your cervical cancer screening every year. All right. Age 21. We don't do it earlier than that, because before it's like we're saying you were compromising the cervix, because the cervix is supposed to hold the uterus together and all that too when you get pregnant. So we don't want to compromise the cervix. We don't want to do anything with pregnancy, potential pregnancy or future pregnancy. All right. So you're getting your cervical cancer screening. Talk to your pediatrician and all for your young daughters and young sons to get the virus, the HPV virus, the vaccine. Okay. Talk to them. That's you, whatever your beliefs are. Talk to them about that. Get your breast cancer screening and look for, again, like I said, watch for the signs and symptoms and all of that. Unexplained weight loss, meaning that you're not doing anything to lose the weight, all right, but you find yourself losing weight over and over, months and months and going by. Unexplained fatigue, you haven't changed anything in your diet, you haven't changed anything in your activities, but you find yourself being exhausted every time. When it comes to the stomach area, all right, diarrhea, constipation too, because some is that constipation, meaning you're not moving your stool the way you're supposed to. Is Some people go like every day, some people go every other day, but a change in that pattern over a period of time. Constipation, diarrhea, severe abdominal pain, sometimes no pain, blood in your stool, blood in your urine, more bleeding than normal when you're on your period, bleeding after menopause. All right. I think I got all that. Bleeding after menopause, like I said, and it could just be something vague and all. All right, but just something, your body. All right, you know your body and you know there's something wrong, and you go and you say, I want to go get that check. And if the doctor's not listening to you, you can always get a second opinion. Most insurance company will help you, got to have a method where you can get a second opinion, okay? Because you know your body. All right. Doesn't mean that we're gonna say, okay, yeah, we're doing something wrong and you know your body or whatever, but it's important. Something is different. All right. And sometimes things will just come up. Some things will just come up and there's no other warning. You go in there for something else and they find out, be like, okay, well, we don't think that's what it is. We're just going to do the surgery. And next thing you know, is something else. If they tell you to follow up, please follow up. It can be scary because you're thinking on your family, you're thinking on yourself, you're thinking, all the plans and goals that you have for in life and all. But please go and get yourself checked. Remember, early detection is key. Early detection is key. Now, that's not a comprehensive list of signs and symptoms and everything, but speak to your doctor, speak to your provider, whoever it is. And women, go have a good relationship with your OBGYN and have a good relationship with your family doctor too, also. Okay. And also take care of your general health. All right. Like I talked about heart disease with women and all. If you don't have a strong heart, you need a strong heart for everything else that you may have to go through. All right. So take care of your general health, eat healthy, exercise, and have good relationship, have dependable relationships, and don't put too much stress on yourself. Try as much as possible not to put too much stress on yourself. Okay. So I don't think I see any questions there, but so please, share the show. And if you have any questions, you can still leave the questions later on. And I usually go back and answer it. Okay. So let me just see here. Oh, River says, bro, say greetings. Hi, thanks for watching. Thanks for watching. Alrighty, so go back in here. So that's basically what I have to say. I don't like to make these things too long. So read about it again. Read about it. Go to your doctor. Find out. Take care of your health. Take care of your health. You only have one body. You only have one body. So take care of it. Take care of your family. Share the show. Talk to the women in your lives. Talk to the people, friends, and all that in your life, and say, did you get your screening yet? Did you get your screening yet? Go ahead and get your screening. All right. We hear a lot about breast cancer screening, but we don't hear about the other gynecological cancers, and we don't hear too much about colon cancer. But those things can like take you early on in life. All right. So if you can find it, early detection is key. Early detection is key. The earlier you catch it, the better your outcome will be. All right. So thank you all for watching. Please share the show. Give me a thumbs up. All right. Talk to you guys later. Bye bye. And for those of you who have not liked and follow Abby Tyler's Healthy Living, I am on Facebook. I'm on YouTube. I'm on. So go in there and click on follow, the follow button, and and I do smaller videos during the week. I'll try to do that more often. Alrighty. So thank you very much. Good night.